for about 15 years. Before that, I was actually a junior doctor in both St Helier and Epsom, so I've worked there many years ago and I understand kind of some of the needs for change. As a clinical chair of the CCG, we're the bit that buys healthcare locally, and so the 3 CCGs around the trust, Sutton, Merton and Dan, so the lead commissioners for the trust, St Helier, so hence why we've commissioned this piece of work to look at the Improving Healthcare Together project. Just to give a bit of background, the IHT project, Improving Healthcare Together, is building on work that the trust did previously. But this is really a commissioning-led programme now, and hence why we're coming out to 3 CCG areas to talk to our local population to understand their views. This issue's been looked at many times. I realise that BSBD was only a few years ago, but unfortunately the challenges haven't gone away. As we know from the video and probably from reading about this in the news and online, etc., there's issues around improving quality sustainably at the trust across the 2 sites currently, providing healthcare for model buildings, achieving financial sustainability. And then in the community, we're looking at delivering healthcare in different ways currently, trying to look at greater prevention of disease, working more closely with our council colleagues and social care colleagues to deliver primary care at scale, and joining up healthcare in an integrated way in the community. Really, one of the key issues, as you know again from the video, is despite the fact that there's a lot of the district general services running across both sides, the major acute services, which are listed as kind of things around A&E and intensive care, and also women's and paediatrics and acute medicine, are really struggling to do that across 2 sites currently. So this piece of work is trying to look at exploring ways around how we can do that better and more sustainably going forward. One of the thoughts is that we would need to co-locate all those major acute services onto one site, and the sites would either be Epsom, St Helier or Sutton as the third option. But really this is a listening exercise. We've not made any decisions. As commissioners, it's our responsibility to commission sustainable and excellent healthcare for you as people living in our districts. The reason for this event is really to sit here and get your thoughts on this information, and it's really just the start of a listening exercise. There's going to be further events through the year. I think there's a couple more events in September currently in the diary, and there's lots of information on the website and also via the 3 CCG websites as well. So it's a very hot evening. Thank you for being here, and thank you for giving up your time. And actually, if I can ask Dr. Ruth Charlton, who's one of the medical directors from the Trust, to give a little view, that would be really helpful. Thanks, Ruth.
I just couldn't stand here. Nobody wants to look at my back or my shoulder, I'm sure. So those of you who haven't met before, I'm Ruth Charlton. I wear 3 different hats. I'm a paediatric consultant in the Trust and have been for over 20 years. I do most of my clinical work at Epsom. I'm joint medical director with James Marsh. I've been that role for the last 7 years. I don't think through how long ago it was I took it on. And I'm deputy chief exec. And I know for many of you, these are discussions that you've been involved with over the course of most of my time here. And I was here a year before Epsom and Henry merged, and have been privileged to be part of discussions about the Trust's future for 2 decades. But I think things really have changed. And I know every time you probably feel we come and have this conversation, well, they always say that things have changed. And I was just reflecting on the way here of how I might, using the very sort of simplistic approach that the cartoon adopted, try and give you my perspective of the challenges that we're facing. And it suddenly came to me that what I needed to do was tell you about my last 24 hours. This is not fabricated in any respect, because it illustrates the challenges that we're facing as committed clinicians on a daily basis. So this week I'm working as a clinician, I'm working as medical director, and I'm also covering Danielle Alcalise, who's having a very well holiday. So you've heard about the 3 challenges we're facing. So yesterday morning, overnight, last morning, as all trusts do, we had an estates issue. We lost power to Rowan House, and the study preoperative assessment facility. So we had to work with our teams through yesterday to make sure that clearly there was no adverse impact on patients, which there absolutely wasn't. To diagnose the problem, which was a part that had melted in the heat, that was part being 60 years old, and then to work with the teams to put in place a solution which in the first instance is short to medium term, while we come up with a definitive plan to ensure that we've got a continuous reliable power source to run a house. So those operational challenges that our estates bring are not insignificant. And over the course of the last few months, we've faced other issues. In Helios Park, we've had floods, we've had leaking roofs. That's not to say those issues don't happen in other trusts. But I think given the lack of our definitive long-term strategy, our buildings really require significant investment to be fit for 21st century healthcare. So that's the estates bit. And then I thought, what can I do after that? So having got us back on track and seen the generator arrive, I was consultant on call. And actually, as consultants on call, we're usually in work for the evening. But yesterday evening, we had a shortfall with a junior doctor gap in the rota because the junior doctors now are increasingly scarce and some of our posts are not filled. And when those posts aren't filled, it requires senior clinicians to step into the breach. And so I spent the evening acting as one of the members of the medical team on the Epsom site, looking after the children and families in the Epsom area. And then this morning, my dangled deputy hat on, was a board member at the Trust Finance and Investment Committee. So it just thinking through those three events that rolled one currently after the other, I think gives an illustration of how, as clinicians in the Trust, who are very committed to providing high calibre healthcare for our patients, we are on a daily basis facing challenges around estates, around workforce, and around making sure that we continue, despite those constraints, and I think we are absolutely committed to this, to deliver very high calibre care to patients of Epsom and St Helier. It's very important to recognise that, whilst balancing the financial challenge that we have to deliver our services within. So I wasn't going to say any more than that. I'm really pleased to be able to be here this evening to listen and to take on board your comments, your observations, and to hear. You've heard our thoughts to date. Actually, there's something we're missing. And I think it's always really refreshing when you come to these events. Always go away with something actually new, a new thought, a new idea, a new suggestion that we can actually incorporate in our onward work. So thank you very much, and I look forward to the discussion this evening.
Thank you, Rachel. Okay, so that is as much standing at the front and telling you things as we're going to do. What we'd like to do now is just to spend a bit of time at your tables, talking through sort of the first half of this, that the case for change, those challenges that Russell and that Ruth have outlined, are those the things that you recognise in the local healthcare system? Are there other challenges that you think are important and need to be addressed? And what sort of vision and model should we be looking at? So clearly the CCGs have set out some ideas about what they think the future should look like and what we should be aiming for. Are those the things that you are looking for too? And bear with us, I know that we have talked, that many of you will have talked about these issues before, and we'll be very well versed in them, but bear with us a little bit so we just get everybody up to speed, everybody around the table, and then we'll spend the bulk of the evening talking about those possible solutions that have been outlined for where major acute services could be located. Okay, that's all talking for me. I'm going to hand you over to your tables. Thank you.
Is my table been on?
Stay put. I'm going to be
So we'll get thanks for coming along. So I'm going to do that. I'm basically going to be discussing the way we prepare. If there's anything you want to add, hand it over and I'll add that in and I'll try and we will spend a little bit of time in the reflections on what we do, the pace of change, the challenges we set out, and anything that's through this. And then I think like emotional.
I missed what was said there because traffic conspired against me.
Well, perhaps.
So I really need to